Hello, everybody, and thank you for joining us here on Pain Geeks, the book club. I'm really excited to invite and to be joined by Tina Price, who will be here with us today. Tina, would you like to introduce yourself? Is that all right? Because I always get nervous introducing people.
Yeah, so my name's Tina, and I guess I'm a person living with persistent pain, and I've lived with pain for 12 years now, following a manual handling injury in the summer of 2018. And I've had a difficult persistent pain journey. So to start with, I was in a pretty bad way. Um, but I still live with pain, but I live with it in a much better way. And one of my breakthroughs was learning to understand pain, which led me to being able to self-manage my pain better.
Yeah, yeah, lovely. And I think that's really what this book is all about. And one of the reasons why I felt this was the first book I wanted us to cover in Pain Geeks was because for me this is really a gateway. It's like a gateway drug. It's like a, that's probably a bad metaphor, but it's like that moment where people and clinicians can start to, I don't know, understand what it means to really embody biopsychosocialism and care, and then sort of spark off that next step of reading, next step of understanding, next step of, and it's that sort of, and I suppose what's happening here is I'm actually reflecting on something you said earlier in an earlier conversation, because Dina and I were both involved in a different conversation just about what, an hour ago.
Yeah.
And you said something there that really struck me. Was you said like a lot of my earlier care was routine
Yeah.
and routine care, and I think for me when I read this, I mean obviously I read this just after the first time at the sort of end of my masters, so I had done my pain training, um already been exposed to sort of the work and voice of Mick Thacker, and like thinking about like you know what does it mean to be biopsychosocial when we're thinking about pain and about all the different complex systems that are the complexity of the multi-system that is um, sort of sort of being part of this coordination of experience. And I think that's what Louis was sort of trying to get us to recognize in this, is that routine care can blind us to the person in front of us. um,
Yeah. Yeah, I totally agree. And I thought the really interesting thing about the book was that you could follow his journey moving from routine care to him having some more insight into what person-centered care is, I guess, and taking that journey. And I've seen actually on Twitter a number of people have, a number of clinicians have said, this book has changed my practice and so on. And I can see that. I can see that maybe if you're used to doing, routine care or that sort of thing, that actually it gives you a different perspective. And it says, doesn't it? I think it says it's okay to have felt like that and it's okay to have moved on. I don't know whether you feel that.
yeah, no, absolutely. And like, so I get the opportunity to work, obviously I have my own reflections of my own journey as a physiotherapist. Like I came out of my degree, which I really don't have a lot of criticisms of the way my degree was taught, because it was a sort of solution focused problem and problem based learning degree. So we did a lot of independent practice and a lot of thinking about rehabilitation and the principles of rehabilitation, but the content often ran similar. Like there were modules of reductionism and things like that, but generally I had a lovely introduction, um, and some really great teachers. But I came out of my degree and still bought into that idea that physiotherapy was mechanistic, that it was pathoanatomical. I went out, I think the first course I did was a taping course, and then I went on like acupuncture and dry needling and massage and mulligans and literally every course you could that was trying to put the body as the solution and the cause of painful experience. And I talked to the therapist and they say the same thing, like how do you manage the guilt of what we've done in those earlier years, and the reality that actually we would have done things so differently, and had we had more information, and what are those people now doing, and how many people have we been a bad clinician for? And I think the humbleness and the sort of like authenticity at which Louis starts this book off and say, you know, this is what I believed at the time, showing how he goes through the change and how it's okay to, you know, have an about turn, I think is inspiring and permissive. It gives us all permission to do that.
And it's interesting because I also found it permissive. So even as a patient reading his journey, going through that almost mirrored my journey. So, you know, a lot of my clinical support and my understanding was very much on the biomechanical side of it.
Yeah.
And it was actually quite comforting to see him move through that journey as I've moved through that journey.
Yeah. Oh, you know, yeah, that's true, isn't it? And then sometimes what I hear clinicians say is like, oh, the patient's very biomedical. And you're like, oh, aren't we la-di-da?
Yeah.
So were we once, you know. Like, yeah, maybe as a therapist that might have moved on, but yet can we still respect and come from a position of compassion and understanding that somebody else quite reasonably and logically is thinking biomechanically, and that's not the person with pain's like fault or lack of, I don't know, whatever, clever. It's just that's what's out there.
Well, I was going to say that's what society brings us up to be, doesn't it? And then clinicians time and time again reinforce that.
Yeah.
And actually, I needed a clinician to help me move past that, and, you know, move into a wider perspective of things. But without that clinical support, without a good clinician to help me do that, and without, you know, reading some stuff like Louis' book and some of the cause health stuff and so on, I would still be there. I would still be that patient, the biomedical one, because I would know no different.
How was it for you to read this book though? What did it? Because I was thinking about this when I was sort of like thinking about, well, what will this conversation be like? What will we talk about? And I kept thinking, what, you know, I read this book and there were moments in it where I felt a little bit like, oh God, I can't believe that's what we thought, and oh, I can't believe that's what we're doing, and oh, why don't we learn this in school? And like, so I went through these sort of like emotions of sometimes quite frustrated that this isn't what's being taught earlier on, and you know, all that kind of stuff. And then I was thinking, what must it be like for somebody not in the physio world, although I think you really are kind of an honorary, like, I don't know what's the word, inhabitant of the physio world, but like, what is it like to sort of see behind the veil almost?
That's difficult because, of course, I have been exposed to some of that on Twitterland and so on. Well, the thoughts that I had related to that were very much, well, I know that if I go to a physiotherapist, if I just book into a clinic or a hospital near me, I'm probably going to still be treated like that. So there was more for me about, well, how on earth do we move practice forwards? You know, I want to be go and see a physiotherapist and be assured that I'm going to be treated in a more person-centered way, which is what Louis comes down, and with a much better understanding of pain. I reckon I probably understand more about pain than a lot of the physios I would go and see. How do we move that forward? They were the questions that were coming up for me.
Yeah, I think that's right. And I think it's that sort of acknowledging of like, are we a profession that is interested and invested in a particular way of looking at the body, or are we a profession that is interested in looking at things like health, rehab, and pain? In which case, we have to move on. We have to keep evolving. Science around that keeps evolving. I don't know how we. Yeah, I think this is some of the questions that not only the individual physiotherapist needs to have, but like the systems that are perpetuating the physio model, and the sort of politics of that.
Yeah.
Need to
But
have.
picking up on something that you said, Laura, though, when I read the book, I read it like it was a novel.
Yeah.
So it was a book that I couldn't put down. And you know, I've looked at various textbooks and Explain Pain and some other stuff, and I've never felt like that about what's essentially a clinical book before at all. His way of writing is just out of this world. I don't know whether there are other writers in the clinical world like that, but his ability to look into himself and provide the insight from his journey, the patient stories that he put in there, that it was a book about people, which, you know, I love. But also his explanations were so good. So I've dabbled a bit with trying to understand top down, bottom up, and all that sort of thing. But the way Louis explained it was really, really good. And for me, it was just penny drop moment after penny drop moment, understanding my own condition much better. And it's interesting because I kept reading that, I kept thinking, why don't other patients read this? Why isn't this recommended for other patients?
Mm.
And I don't know. I mean, you know, I've got a reasonable health literacy, and it was perfect for me. Would it be perfect for other patients? I don't know, but it's a great book.
Yeah, it's interesting that you had that experience of reading it. I think that is what he wanted us to feel, and I think other clinicians as well, and other people that have said when they've read it, they sort of almost feel like they've got to know him as a person. And you know, speaking to people like Mick about Louis, and you know, Steve Robson, who also helped to edit the book, and you know, the way they talk about this person and this really humble man and great clinician and generous teacher, you know, I think you get that on every single page.
Mm.
And it's a really interesting point. It's a great point. You know, I've never read a clinical book like this. I'm used to picking up reference books, and you know, I have to say that, you know, I picked up this book and thought, okay, what are the chapters, where do I want to start, what do I want to see first, just the way I would normally with a reference book. But that's not what he intended for this. I think he wanted us to go on the journey with him. He wanted us to see how we have moved on as a science-based profession, but yet clinical practice hasn't necessarily gone followed that. Wanted us to take us on that journey, and I think it's a really interesting quality, and it's novel, and it is novel in its way, right? So
I agree. If I was going to write a book, that's the way that I would like to write it. I mean, you can't mimic somebody else's style, but it was the perfect style for certainly for me. And the other thing is, when you live with pain all the time, you know, I read some books and I think to myself, no, you don't get it. But he gets it. He really gets it. And I could identify my condition with his writing really well, really good.
yeah, it's really interesting, isn't it? Because representation matters, doesn't it? If you feel represented in the text, you're going to it has a much bigger and sort of wide reaching effect, doesn't it? Like if we are saying we are pain clinicians, or clinicians that are holding their hand up and saying, I understand a bit more about pain than the average person, we probably need to be able to represent the experience of pain that people are having in the book about it.
Yeah, no, it's good. And he just brought in some really good stuff, didn't he? I really liked all the numbskull stuff.
Yeah.
So you know, that idea of the Beano numbskulls and the way that they were talking to each other in the body, I just found really useful, bringing it down to that sort of level and imagining what is going on in my body, and the I don't know what to call it, but the balance between the top down and the bottom up, and what's actually happening in there.
Yeah.
It was good.
I think what he did for me in this body, I mean, Okay, I don't know whether you ever did you ever watch that cartoon program? I think it was back in like the 80s or the 90s, and it was a cartoon about the body, and it was called Once Upon a Time Life. And I remember watching it when I was a kid, and everything inside the body was kind of alive, and they were communicating with each other. You know, the white blood cells were communicating with the red blood cells, and you know, the brain was communicating across all the systems, and it was thinking about how it can coordinate this whole multi-system thing that is a person. And it, every now and then it would zoom outside and you would see the cartoon person from there in my mind. And when I was reading this book, there was a moment where I was like, oh, and it reminded me of that cartoon. I was like, oh, the lived body is a living body.
Mm.
And I think it really brought it to life, and it was a great moment be to start understanding tissues from a different perspective, from a living perspective, as opposed to from a sort of like almost like from a
Picture book perspective.
book or a kind of cadaver perspective. You know, that kind of everything's reduced down to these almost like non-living tissue structures,
Yeah.
abstract everything. You know, we're taught everything in the abstract, aren't we, as often
Yeah.
as clinicians? And it was a sort of like moment for me where I remembered that this is a living multi-system organism that's
Yeah. Yeah, absolutely. That's influenced by many different things. It's yeah, no, it's good.
yeah. And it's that I think it's that kind of humanizing that I found really interesting. You know, like humanizing tissue, humanizing systems within the body, humanizing the way the person lives within the environment and how that affects what's going on inside their physiology, and how that can have an impact on the sort of the way the body shows up for someone and the way we experience the body. And the humanizing of himself. He's kind of modeling all the way through. I am human, you are human, we are all human.
Yeah, absolutely. And that's what makes it readable and understandable, isn't it? It's yeah, absolutely. And it's interesting because it's not just that, his explanations are really good. So his explanations of the top down, bottom up stuff, I mean, I'd struggled with that. I mean, I've had a bit of an introduction to that. But he explains it really well, really, really well. I I just wish he'd, I mean, you know, it's probably wasn't his thing, but I wish there was something like this that was written for patients, because that's what's needed, I think. I mean, different patients need different things, but I needed the level of detail that he goes into to fully understand all the other little bits that have been, you know, taught to me or floating around in my head, to understand my situation and to deal with it.
Yeah, yeah. I think many people do, and you know, certainly in the sort of area that I work in, and the kind of experiences of pain that the people I work with have. I mean, they're at the point where actually, and I think he even says this. You know, people in pain, what they're all asking for, I can't remember where it was, is, you know, rational answers to what are quite simple questions, but there are complex, perhaps complex models as to how that might be being worked. And if we can't give those answers, then the person with that experience is still going to struggle to make sense of it, because
Yeah.
there is no answer then, is there?
No. The other interesting thing was when I put on Twitter just before I read them that I was going to read them over Christmas and so on. There is such an outpouring of people really respecting Louis and respecting the books and so on. And it wasn't until I read them that I could understand that. You really do have to read these books, don't you? I mean, I've spent the last year thinking, oh, you know, everyone says Louis Gifford's books are wonderful, and I keep thinking, oh gosh, but they're expensive and all the rest. And then I think, well, actually, they're written for clinicians. I probably won't understand them, but they're not like that at all, are they?
No, they're not, and they're very very accessible. And I think that's because, again, what I see in this in through Louis, who I never met and never got the opportunity to learn from, is this constant modeling of just humanity and authenticity. And it's sort of in every single page, it just jumps off this, you're experiencing his humanity, and that is encouraging and permitting us to show our humanity in our profession. And that seems to be the thing that we don't always allow ourselves, or as a professional body maybe.
Mm.
And yeah, I think that's it. And you do have to read it to experience. It's like a 3D experience. You're feeling it, and you're reading it, and you're learning it, and you're imagining it, and you're starting to reimagine yourself as a clinician in this way.
I would have thought that it's a book that should be on all university reading lists. I mean, it may be already, I don't know. And all physiotherapy and other clinician reading lists, to be honest. I mean, and I wouldn't say that about any other book.
No, I don't think I would either. And so I wanted to ask you a little bit about the mature organism model.
Yeah.
It's a model that I think doesn't necessarily get a lot of attention in the pain world at large. And I remember reading, and I remember that moment where I started to understand, like, there were a few moments when I was learning about the mature organism model that changed my, I don't know, direction in terms of what I wanted to read next and what I wanted to learn next. But what was it like for you when you first started thinking about, when you first started reading this, sort of when you started explaining where the mature organism model came from and how he understood it? Did it help you?
Yeah. So, I mean, it helps that he obviously builds up to that. So, you need the prior explanations first. And I had seen the mature organism model in a picture before, but yeah, no, it completely works for me. This idea of sampling and scrutinizing, and that produces, various outputs, which then has an impact, and it all goes round in circles and circles. And he has more than one diagram of it, doesn't he?
Yeah, I love it.
And he builds on it, which is really good. But yeah, this whole idea of the brain sampling itself through past experiences, knowledge, beliefs, cultures, and so on, it's a sort of understanding that for somebody living with pain, I need to understand that that's what happens. And if I can understand all that sort of stuff, then I can deal with it and I can manage my situation.
Yeah.
But again, he just puts it in a way that is understandable, makes sense, and is relevant to me.
Yeah, the brain scrutinizing itself for me took me by surprise. It felt like a unifying moment of what we're saying, what psychologists are out there saying, and how that is influencing and impacting on this kind of the whole person coordination of experience. And I remember thinking, oh, that's what we're doing. We're just scrutinizing what's already there, and wondering how it fits, and does it agree, and is it useful or not useful, does it, and not in a kind of cognitive decision way, in a kind of does it fit the sort of the input, does it fit the message and the incoming information, the stuff that I've experienced before, can I just reuse that, or is there something coming in telling me no, there's a different way of thinking about this? And this sort of constant looping. I thought that was a moment for me where I got a bigger understanding, or maybe I delude myself that I've got a bigger understanding.
Delude myself too.
But that sort of feeding, that sort of loopingness, that sort of, there is no beginning and end, because we don't have a beginning and an end as a human being. There is no beginning and an end of an experience. It just continues on.
Yeah, which is exactly what happens, isn't it? The other bits for me of Louis' work was that he doesn't talk about pain as being danger.
No.
and I like that, because I find the concept of pain only being about danger to be quite difficult, because, you know, when my sciatic nerve is suddenly has a jolt of pain or whatever, I you know, it's not in danger. To me, my understanding is this isn't about danger, this is about impulses and so on. And the way he explains it is much better. I think he also talks about threat rather than danger. I might have got that wrong. But you know what, the other bit that I hadn't picked up on before is, you know, he talks about if you maybe fall over, have a cut, then it will carry on hurting. And I don't know that we talk about that carry on hurting so much, and that actually the pain is there to warn you to look after it and all that sort of thing. So I found that quite interesting as well.
Yeah, and how does that change your understanding then? How does that move you on?
Um, oh, that's difficult, isn't it? So, well, there are two things. I mean, one, it just helps me understand my situation and pain in general better.
Yeah.
But the way it helps me move on is if I understand what's going on in my body, then I can adapt and I can change. He talks quite a lot about nocebo and placebo as well, doesn't he? Which that was fascinating. I found as well. But yeah, I can adapt my life in order to, you know, try and maximize my situation. I don't think I'm making any sense, really.
Well, no, and I think he uses an example of pain being like an earworm, doesn't he? Like,
Mm.
it doesn't necessarily require us to have
Yeah,
attention is part of how we how we, I don't know, experience pain. But if we can think of it more like an earworm,
yeah,
pain can carry on, and it doesn't necessarily mean that we are in danger. There may well be tissue damage, and but that's not necessarily a dangerous thing.
yeah,
It's something that can just happen, and it can
yeah.
carry on.
And again, I mean, his explanations on that were really good. I think he suffered from tinnitus as well, didn't he?
Yeah.
Um, but yes, and it's really nice to identify with. So it's nice to identify that, you know, if I'm in a meeting, well, I'm talking to you now, I don't feel so much pain because I'm concentrating. Give me half an hour and I'm not talking to you, then I will feel it again. But it's also, it helps you manage your life and move forward with your life, because I know that, you know, I can carry on being busy, I can carry on being interested in talking to people, and I know that that won't have a negative impact on my pain. It will probably have a positive impact. But yeah, no, he was good at that.
Well, it was a lovely book, and I think, you know, these are the kind of you know, what I found, and perhaps this is what you're also alluding to as well, is that my fear of pain, which has been built up as a social construct, it's culturally, contextually relevant to an understanding of pain as a direct result of tissue injury that can then be fixed in a sort of pathoanatomically focused healthcare system. This book almost started to deconstruct some of that lifetime learning, and
Yeah,
helped me to create a new understanding of pain,
yeah,
not necessarily always as this really deep meaningful experience, but as, you know, if we think about um ectopic pain, you know, where it just randomly fires off because, well, it's not random, but, you know, like,
yeah.
there's something.
Feels random.
Yeah, I imagine it does. Well, I mean, I get, I mean, I don't live with persistent pain, but, you know, every now and then there'll be a part and it'll just go ting, and I'll go, oh, what is that? That's weird. And, you know, it's that sort of, but I guess because I don't have a background experience of pain that I'm worried about, or it doesn't come forward as being particularly meaningful. It's just, well, that was weird, and then off I go. But if we can think about it, does it do that for everybody, this book, or is it just what I experienced was this kind of like, okay, I don't necessarily need to keep applying this sort of like deeper meaning onto pain. It can just be something that happened and it's something that's there. Yeah.
No, I think you're absolutely right. I think I think there is quite a lot of meaning to be put that is put on pain and so on, and I've been there, but actually this book and some other stuff has helped me to understand, actually, it's stuff that's going on in my body. I can affect it by putting my attention to something else, or however I'm going to manage that pain, but it isn't going to do me any more damage. So yes, I can walk I can walk around a park or whatever, and by the end of it I can be in quite a lot of pain, but I'm not harming myself. And actually that's really useful, that's really helpful to know that sort of thing, because you just then think, right, okay, I'm going to make a choice. I want to go for a walk. It might result in pain. It's not going to do me any harm. I'm going to go and do it anyway. Whereas before I was much more fearful of what I was doing.
Yeah.
So yeah, it is useful, isn't it?
It's interesting as well, though, isn't it? Because there's this sort of idea of reductionist science, reducing down, going right down into the tissues as being a problem. But actually, that's one of the things that he does in this book, is he goes right down into the tissues, but just further, to the point where the biomechanical and pathoanatomical construct is almost no longer relevant at that level when you go right down into that level. And it's almost like the biomedicalism of this is one of the things that is powerful in terms of liberating us in a way, because it's explaining the physiology in a wider system, in a wider multi-system, or complex system,
Yeah.
that gives that biology a bigger context so that we don't get too caught up in it.
Yeah, I think you're absolutely right. So I think absolutely the biomedical stuff is hugely important, but it needs to be balanced with the wider understanding, and I think he does that really well. So I learned quite a lot of the biomedical stuff. I mean, I admit some of the biomedical stuff, when we got into Schwann cells and all that sort of thing, some of that, I reckon I've understood probably about 95% of the book, but there was an element when it got really deep,
Yeah.
that I didn't necessarily appreciate. But I wanted to understand that biomedical stuff, but I wanted to see it in the much wider picture. And he does that beautifully.
Yeah,
He does it really well.
it's the why is this biomedical stuff important, as opposed to just what is this biomedical model. It's like, it's why, how does this exist in a human being, and why is it relevant, and why are we looking at this? And he does that in a way that I've seen very few people do, but obviously I've had the great privilege of being taught by some excellent clinicians, so to say I've never seen anyone else do it would be completely untrue. But it is a unique skill that he has, that
Yeah.
many clinicians or teachers have.
Yeah.
I always think this book could probably replace like 70% of the physiotherapy undergraduate degree.
Yeah.
Just read the book and then go and do
Yeah, absolutely. So was it on your reading list?
it.
Was it a book that was suggested to you to read as you went through your clinical training?
So this book came, I'm not exactly sure, when did it come out? I don't know whether it came out whilst I was doing my masters, or whether, yeah, 2014. So I was doing my masters at that point at King's College in London, with, and it was the advanced NMSK masters, which was typically the MACP manual therapy sort of accredited masters, which was an experience. And but that on that course there was a module around pain and pain mechanisms and how they might work, that was led by Prof Mick Thacker. And at the time when I was doing my course, the books came out, and so I would say most of us went off and read the book. And it was it was really interesting, because once you've read this book and then you go back into master's level musculoskeletal training, talking about mobilizing the sacroiliac joint, you are very conflicted, and
Yeah.
conflicted not because you don't see the value in the manual therapy, because to say that there's no value in manual therapy I think is unfair, because we've been using manual therapy approaches for the human experience of pain like way back, like since Aristotle. So it's not like we're all of a sudden going to realize that manual therapy doesn't work, because that's not really a valid that's not the interesting discussion here. It's how or why or when or for who, and you know, what are we trying to achieve, and should we, is the question, I guess. Should we continue with this model based on what we're seeing now? And I think you know, Louis wasn't, my understanding is not that this is an anti manual therapy book, it's an anti biomechanicalism book, or not even anti, I wouldn't even say, that's probably quite strong, and I don't want to put words in his mouth or anything like that, but I see this as a kind of kickback to simplifying what we do as physios, and it's inspiring us to come towards complexity understanding and complex modeling.
Yeah, I agree. And it was actually quite nice as well, wasn't it? I mean, he obviously had a very special relationship with Mick Thacker. Yeah. It was nice to see. I mean, I felt I got to know Louis through the book, but it was nice to see Mick keep being mentioned and talked about as well.
Yeah, and you know, really had the lovely opportunity to chat with Steve Robson, who also helped in editing and helped to teach with Louis. They taught together and sort of had a lovely relationship as well. And knowing these two friends of his and getting to you really do feel like this is a really genuine example of just the kind of person that Louis really was, and the way he understood clinical practice and the way he approached really caring for people, like really cared. And it's been and you know, I remember my mum was an A&E nurse and a pediatric nurse, and she was a band 5 nurse her whole life, and could have gone up the scale if she wanted to, but didn't want to. And I remember when she used to come home and she'd just be so frustrated because it felt like we were theorizing nursing and removing care from the model. Nurses didn't sit down and talk to people anymore. They didn't, you know, they didn't like wash people's hair and make sure they were okay. And they didn't also, you know, take in the whole human when they were thinking about medications and management and all that sort of stuff, and creating an optimal environment for people to thrive in. It had changed. And when I came into physiotherapy, you know, I was taught by lovely clinicians who cared deeply about their rehabilitation work, and I wasn't taught by MSK clinicians. You know, the leader of the module of the physio degree was there were neuro clinicians as well as respiratory clinicians. So we had a really different mix of people that were leading on how the course worked, and so we got a totally different perspective sometimes. But like it did feel like I sort of came out into clinical practice, and there was just no space for care. Like 20 minutes in, 20 minutes out, one after the other. There was not even enough space to go for a wee in between patients. Like there was no relief for anyone, actually. There's no relief for the clinicians, and there's no relief for the people who are in pain. And when you're reading this, you really feel like there is this real urge for us to return to a place of deep caring, informed medical information, and you know, good decision making and science-based healthcare practice, but really care is at the heart of it.
And it's interesting, isn't it? Because, you know, in my persistent pain journey, certainly, you know, I've seen loads and loads of clinicians. I've seen quite a lot of physiotherapists. And, you know, the first 4 years, I would say that the physiotherapists I had were caring people. But for me, it wasn't effective. And yeah, I'm sure that it was, you know, I was in there for 20 minutes, half an hour, and they were perfectly caring, but then I left and they went on to see their next patients and so on. And it needed a clinician for me to really care and really get to know me.
Yeah.
And, cost effective wise, if that had happened earlier on, I wouldn't have needed all those other clinicians. So there is something, isn't there, about, I think we have lost that. And I think, we need to go back to that somehow and genuinely care. Be interesting if COVID has any influence on this, won't it?
Yeah, and I think what I mean, yeah, and this is it. So when I use the word care, I don't mean like just being nice to people.
Mm.
There's lots of really lovely clinicians out there who are really nice to their patients, who really do want to do a better job. But what I understand from care is that you care enough to acknowledge where it's not working and then do the extra work to try and figure that out. Like, I feel like that is our role as clinicians. That comes with the responsibility of being on the healthcare register, of having this I don't know, access, I suppose it's not the right word, but this opportunity to work with people when they're in their most vulnerable place. It's the sort of, okay, there is this thing out there called pain, that this new science out there looking at pain. Yes, it's really hard for me to understand. It's going to require a lot of change and a lot of time and effort, but it's part of caring, right? It's part of what we do, I think.
Mm.
If we think about the earlier days when, say, for example, sterile nursing techniques came in, people had to go and relearn how to, I don't know, deliver injections in a way that was now more process heavy than it was before. So it took longer. It was completely different. It was completely new. But there's no question that they would have to learn that. There's no sort of like, oh, well, it's your position as a nurse. You can choose not to do it if you don't want to. There's
Mm.
no question around that. It was, this is our responsibility to updating our healthcare system.
Yeah. And there must be a responsibility for all physiotherapists to have a better understanding of pain and to be better able to communicate that understanding to patients, basically, because all physiotherapists must be working with pain. I can't believe, I mean, it must be pretty bread and butter, isn't it?
MSK clinicians, I would say, because physiotherapy. That's one of the issues actually, is
Mm.
that physiotherapy is so diverse. Because so we've got MSK clinicians who embody a certain type of physiotherapy, and then we've got respiratory clinicians who embody a different type of physiotherapy, and people working with stroke, people who've been through a stroke, or people who are born with neurological disorders, or all of these. And there may or may not be pain as a part of that experience, but there's certainly lots of overlap in terms of the experience of being ill and of losing autonomy and agency and of being confused and of not being sure and of not knowing. All of that is huge overlap. And we, oh, sorry, that's the mail, the post. There's so much learning possible across the different aspects of physio. But what I see we're all doing is really a kind of rehabilitation, and that's what I really got out of this. It was a recommitment to us as rehabilitation therapists,
Yeah,
um, as
I
a
agree.
tissue injury management therapists.
Yeah. So I've always said that if I'd been treated like a stroke patient the day that I had my injury, I would have had a much better journey with pain.
Yeah.
So, and that's all to do with rehabilitation, isn't it? Because that's what I needed. I needed to understand pain. I needed to, I need medication to start with and all the rest, but I needed to be rehabilitated. And going back to your care thoughts, I think, if physiotherapists, clinicians really care, then they don't just look at the person in the clinic, they look at that person in their lives outside and try to help that person to move forward.
Yeah.
Don't know if that makes any sense.
Yeah, it does. And we can't do that if we can't always do that or get to that, or we somehow wait for that. And I think that models what's happening in society as well, because we're waiting to fix the pain first in order to then do the rehab. And actually, the rehabilitation may well be part of the changing and modulating and adapting of how pain is showing up, because pain isn't the problem. It's what's coming because of what's happening across the system. And so we want to work with the full the full system integrated within society and its environment, the environment. I keep saying it's, and that I recognize the dehumanizing language there, and I apologize, because the system is of course the person, the agent, the person that's doing all of this.
Yeah.
Rather than trying to work directly on the experience of pain, it's, well, what is contributing, what is coordinating this experience?
Yeah, absolutely. And you know, one of the bizarre things, well, it's bizarre looking back, was that almost every time I had a physiotherapist, they would discharge me while they waited for somebody else to fix the pain.
That's a really sad thing. I'm really sorry about that.
That's all right.
No, but
It's not quite as black and white as that, but
it's quite a common experience. And, you know, working with the undergraduate students, that's often what they say. Well, I would refer them on. We'll refer them on to where? To what? For what? Why? And what's going to happen in between then and now? You know, this constant, I will refer on, I'll refer on. It's a constant giving up of our role in somebody's rehabilitation. We're sort of, it's a sort of passing the buck sometimes. And it's not, I can understand it because we teach that. I can understand where it's coming from. I'm just sometimes wondering, what is the solution?
yeah. I don't know.
More to come from the wonderful Louis Gifford and Aches and Pains, but this book is a beautiful place to start. Please do go out and read it, and there will be I will make sure that there's another link to how you can get your hands on it through Aches and Pains and their local publisher, which makes sure that the money goes to the right place, yes. And that, you know, and also, you know, Louis' blog is still up and available, so you can still go up and read some of his earlier work, as well as the other stuff that he wrote for Topical Issues in Pain, editing that series as well. But I will put a list of things that he wrote and did underneath this as well for everybody who's interested. But lovely. So next up we have the nerve roots, and I'm going to be talking with Tom Jessen, who is very interested in neuropathic pain and radiculopathic pain, and how we construct care and models of therapy around that, and understanding, and how we help people understand what they're living with and what they are experiencing. So very exciting to be able to host that conversation. And then at the end of the series, I will be joined by Steve Robson, who helped with the editing, to talk more about that whole process and how that came about, and just some lovely stories about Louis, so we can all remember and continue to be inspired by this great man. So thank you very much.
Brilliant. Thank you.